Nigerians have been advised to prioritize periodic health checkup. This is coming as 600 Kwarans benefit from Rotamedics pharmacy free health check during the 2021 Wellness Day. Speaking at the event, the Chief Executive Officer, Rotamedic Pharmacy, Dr. Abdulrahim Malik, stressed the need for regular checkup.
Yeah, it's very important if they want to live a long life. You have to know what kind of disease your body, if you are healthy, what you need to do to be healthy. So coming yearly is an advice, and it costs nothing to the general public. You see a medical doctor, you see a dentist, you see pharmacists, you see a lab scientist. There was a man there now that just said he had issues with his eyes. He has not been able to see a doctor. So I sent him to one of the eye doctors. I don't know what they will diagnose, but he has had it for years. He doesn't know what it is. So things like this can help in diagnosis. So people can treat. There was a lady just told me now she was giving drugs for ulcer. So she's been having stomach problems. She didn't realize it's ulcer she's been having. So with this diagnosis now, she can have a better quality of life. The government can organize it. I think the hospitals are free, but sometimes publicity is needed for people to know. It's not until you are sick before you go to the hospital. So in that case, there can be public enlightenment from the government to say, look, you don't have to be sick before you go to the hospital. And if you do that, when you eventually get sick, the cost of treating you might be reduced if you have started prevention before you got sick. We started this, like I said, about 10 years ago, and from what we have seen, other pharmacy premises have started organizing. They started organizing, they do their own on a smaller scale, but they take care of their community. So more people are doing it, and you can see a lot of people appreciate it. They are happy, so it's encouraging for others.
Also speaking at the event, some of the doctors disclosed their findings.
I'm Dr. Adiola Bolaji. I'm an house officer at the University of Ilorin Teaching Hospital. Actually, we are here for as an health officer for Rotamedics Pharmacy Health Awareness Annual Campaign. So I'm here to consult, and so far so good. It's been good. It's been good, and I really commend the MD for creating such an awareness. At least from my experience here, people are becoming. It has really helped people to become more aware of their health issues and the needs for regular checkup and visits. So
one thing is clear: a lot of people neglect their dental health until they start having crucial problems, pain. In fact, people don't come to the dental clinic unless they have pain. And from what I'm seeing here, it's not so different from what I see in the clinic, because a lot of people actually don't know the extent of damage that has been done. And when they are coming to the dental clinic, or when they're coming to for an outreach like this, it has already gone so. But luckily, we were able to point out or screen out some people that theirs is at the early stage, that they can still maybe feel a hole in their tooth before it gets so bad that the only option is removal. Since I came to Ilorin, I don't think I've experienced a robust outreach like this that involves almost all most of the specialties, most of the key specialties. We have the optometrist, we have the dental, we have the medical laboratory, and quite equipped with the equipment that they need to do an effective outreach. So I'm quite impressed, I must say.
With antibiotics, hypertensive, antiemetics. Even for the hypertensive, I discovered that some of the patients that came here for the medical outreach, some are not even aware that I'm hypertensive. So we had to check the ones that were hypertensive. We cancel them. Lifestyle, and medication too. They should adhere strictly to their medication instead of skipping medications. There were also some patients that skip medication. They tend to take their medications after like 4 days or 3 days when they come down with those symptoms, which is not supposed to be so. So we had to counsel them to take their medications properly, take their medications every day. And then in the pharmacy here, we check medication BP. We do BP checks for people every day. So I had to counsel them to be checking their BP every 2 days or twice in a week, depending on how convenient it is for them, because it has to do with their health.
Meanwhile, some beneficiaries who spoke with National Telescope expressed their appreciation to Rotamedics Pharmacy for the free health check-up.
Inú èèyàn dùn gan-an torí gbogbo èèyàn ló jẹ àǹfààní ẹ̀. Àdúrà náà yóò sì máa bá Abdul lágbára Ọlọ́run. Ó dáa gan tó gbé kalẹ̀, ó dáa gan. Many tests. Èyí tó ṣe ní kínní kò tó ìyẹlé ìtẹ̀wá tó á pọ̀ gan. Wọ́n ṣe eye test, eyín, ojú, BP, then diabetes, wọ́n ṣe blood sugar, wọ́n ṣe ti tẹ̀jẹ̀ kílókọ̀ tí ń jẹ́ malaria, wọ́n ṣe gbogbo ẹ̀ náà wọ́n ṣe fún wa, wọ́n sì gba kọ́bọ̀.
In fact, kódà ẹ̀lú ògo Ọlọ́run ní balẹ̀ iṣẹ́ ìjẹ́ agbára Ọlọ́run. Ẹni tó ní ilé iṣẹ́ yìí Ọlọ́run bá yóò jẹ́ kó máa tẹ̀síwájú ni, kò ní ṣàìsàn, kò sì ní sáré, ilé iṣẹ́ rẹ̀ sì ní jóná. A dúpẹ́ lọ́wọ́ rẹ̀ gan-an. Oríṣiríṣi mo sì ń bí báyìí o, bí oríṣi 5 gan ni mo ti ṣe tí wọ́n sì tẹ́ wa lọ́rùn.
Ó fine, ó dáa, ó necessary torí èmi gan-an mi ò lè ṣe kí n má lọ hospital, kí n má lọ wo ara mi wò, lẹ́yìn kí n má lọ check up. Ó dáa kéèyàn mọ check ara rẹ̀ every time. Ó dáa gan-an.
Ó wúlò gan-an. Ọlọ́run jẹ́ kẹ́ni tó gbé kalẹ̀, Ọlọ́run jẹ́ kó gùn lẹ́mìí. Ó dáa gan-an, ó wúlò fẹ́ni tó bá mọ̀ ọ́n, torí oore ńláńlá lélẹ́yìí jẹ́ fún wa. Torí pé gbogbo ohun tí ò ṣẹlẹ̀ tó bá ń ṣẹlẹ̀ báyìí ni àìsàn ó dínkù fún wa lórílẹ̀‐èdè.
It's wonderful. You can see a lot of people around here. With me, a lot of people are suffering from one thing or the other. If not by free like this, it would not have been easy for many people. But by the advertisement and everything now, you can see how people turn up. With me, there are a lot of people facing one thing or the other challenges. But by doing this now, it really helps a lot. It really helps a lot. Such a thing like this is very, very important to bring it to many people, to help people. Because many people are dying of sickness even when they are still supposed to be alive. But they are no more today because of one challenge or the other, and there's no money to take care of them. So if people can rise up like this and help a lot of people to benefit such a kind of a thing, it's going to really help. It's going to really help, and I really thank God for the organizer of this by helping people to out of their challenges.
Àwa fún àyẹ̀wò ọ̀fẹ́ tí wọ́n ṣe fún wa tí Alhaji Abdulrahman Malik tó ń ṣe fún wa, Ọlọ́run kó bá ràn lọ́wọ́, iléeṣẹ́ rẹ̀ kó tún mọ́ gbòòrò sí, ẹ̀mí gígùn àtàlàáfíà kó bá fi jíǹkẹ́ rẹ̀.
Ètò tí wọ́n ṣe lónìí mo rí sí pé wọ́n help àwọn èèyàn, gbogbo àwọn tí àìsàn bá ń ṣe gbogbo wọn là ń dá lóhùn. Ọlọ́run máa ràn wọ́n lọ́wọ́, Ọlọ́run máa gbé iléeṣẹ́ wọn sókè, iléeṣẹ́ wọn ò ní jóná, gbogbo àwọn tó ń ṣiṣẹ́ fún wa náà tó ń test fún wa wọn ò ní ṣiṣẹ́ ṣe.
Alhamdulillah, in fact I can't find any adjective that really qualifies this program. Only to tell God to continue to bless the man that really thinks this thing, that organized this program, that thinks the masses need to benefit from his means of living. Because looking at the numbers of people that are here, looking at the program itself, looking at the numbers of tests that I personally have undergone here, if every Nigerian can have this sense and really do it the way he is doing it, then we will have a better world.